Hello, this is Dr. Robert Bruno, and you may also know me as Dr. RJB. And today I wanted to talk a little bit about body sculpting. Sometimes people do all the exercises they can, they diet all that they can, and yet they still have fat deposits that won't go away. In men, this can be can be particularly troubling if the fat deposit is in the chest area because it gives the appearance of a man having boobs. They call it pseudogynecomastia. It's a fat deposit in the breast that causes the breast to become bigger and have the appearance of a woman's breast. This can be extremely embarrassing for the man. Another part where the men have problems with is in the stomach. They do all the sit-ups, thousands a day, and they still can't get the six-pack. For women, there's a few problems. One is the hip area. Women can collect fat in the hip area that just won't go away. They also have a problem with the lower abdomen that sometimes give a droopy appearance to the abdomen. Again, even though they've dieted and exercised the abdomen, nothing seems to help. And in some cases, the problem may be a situation where there's a asymmetry of the fat collection. So in other words, one hip may be larger, one thigh may be a little bit larger. Even sometimes one breast can be a little bit larger because one breast has more fat than the other. In these cases, sculpting of the body can be a help to remove the excess fat or to try to shape the body a little bit so that the body is evened out. For men who want that six-pack stomach, you can remove some of the subcutaneous fat and the six-pack will appear. For women, they can shape those areas that are not responding to exercise and help to give a fitter appearance. Now, sculpting of the body can be done several ways. You can go to the plastic surgeons, pay thousands of dollars, and the plastic surgeon may use liposuction or surgery to remove those fat deposits. Generally it's, going to work because, the surgeon's right there to do the technique. He's not going to miss the fat. The problem with these techniques, though, that you have to remember is that any surgery carries the risk of scar tissue. I actually have had a patient in my practice who had liposuction done on the abdomen, and they had a stomach that was kind of a washboard appearance. It appeared to be slim, but if you touch the abdomen, it was like as rigid as a board with scar tissue that you could feel. Again, if you have this appearance of a washboard stomach where there's a little bit of rippling, it just doesn't give a nice appearance. The other thing is that surgery also carries a risk that any surgery carries, which is things like bleeding, infection, so you start out with, let's say, a little bit of fat in the abdomen, and now you got an infection in the abdomen that has to be treated aggressively. You have excessive bleeding, and so you now have replaced the fat with a pocket of blood. So these are things that any surgeon knows are complications from surgery. If you're talking about a surgeon removing your gallbladder, which can be a life-saving procedure, those risks definitely have to be accepted. But when you're talking about a cosmetic procedure, which the insurance is not even going to pay for, and you're left with scar tissue, bleeding, and possible infection, you have to wonder, is this the right way to go? Now, With body sculpting, these are generally non-invasive techniques. They'll sometimes use ultrasound or radio frequency techniques or vacuum techniques to shape the area. And because it's non-invasive, there's less risk of complications. Now, there can be some bruising with some of these techniques. There may be some soreness in the area where the fat has been removed. But in general, there's a lot less complication with the non-invasive techniques than the invasive surgery. Now, I have on my Facebook page a link to Melissa Quinones, she does body sculpting and also sells some beauty products. You should check her out. I'll try to leave a link on the Facebook page with this video. Take care.